Good evening, friends. I am Dr. Mhadeshwar. Today I am going to discuss about prevention of complications of diabetes mellitus. There are many complications because of diabetes, and many times we treat these complications. The treat complications of diabetes will cost lakhs of rupees, and at the same time, these complications they are not reversible. So always we should remember how to prevent these complications. So by treating diabetic patient to control blood sugar, which is called as glucose-centric approach, is not adequate. There are many other problems with the diabetic patients. If we talk about the complications of diabetes, there are macro and micro, and these are the defects in the vessels, cardiovascular system or cerebrovascular system. These are the defects in the vessels. So it is called as macroangiopathy and microangiopathy. Macroangiopathy are with the brain, the cerebral, then with the heart, cardiac, and the peripheral vessels, especially arteries of the extremities. So these are the macrovascular complications. And regarding the microvascular complication, they are of a very small vessels of the retina, that means of eye, then kidneys and the nose. So to prevent this complication, no doubt we have to control the blood sugar, which is always high with the patients. But at the same time, there are many other defects. By Dr. D. Franzo, who has explained about the 8 core factors, means octet. Definitely we can manage, we can treat those factors, and there are 4 other more factors, and including this 8, these 4 will be, it is called as dirty dozens. There are 12 different factors, they are called as dirty dozen. And to treat these all dirty dozen factors, there is a need of controlling high glucose level. But in this diabetic patient, suppose if you treat eye problem, then every year, at least once or at least twice in a year, we have to refer this diabetic patient to ophthalmic surgeon for the fundoscopy and visual checkup. At the same time, there are some patients where you will find there is a deficiency of vitamin A or vitamin B12, vitamin C, and to prevent the complications of the eye, especially retinopathy, there is a need of all these vitamins also. Regarding brain vessels, cerebral problems in a diabetic patient, especially cerebrovascular accidents, there is a need of blood sugar. At the same time, there is a need of control of high blood pressure, dyslipidemia, and obesity. So if you take care of this problem, then perhaps this macrovascular complication can be prevented. At the same time, regarding the heart, there is a need of regular checkup, cardiogram or 2D echo or hypertension, dyslipidemia. These things are much more important rather than only controlling glucose level. If the person has got habit of alcohol or tobacco or smoking, then the risk of this cardiac complication doubles. So these bad habits or these habits should be stopped by the patient. Regarding nephropathy, many times all these patients, those who suffer from diabetes, they get somewhere pain or joint pain, and for this purpose, all these patients they take painkillers, and these painkillers are very dangerous for in a diabetic patient for damage of this kidney. So one should always advise to our patient that please do not take any painkiller, and at the same time regular checkup and kidney function test KFT, especially serum creatinine, then GFR and blood urea, urine microbiome, this test should be done at least once in a year. And the patient is suffering from nephropathy, then we have to repeat this test every 4th month or 3 months, so that we can assess the damage of the kidneys. And at the same time, this patient might have some infection somewhere, or there is possibility of calculus in the kidneys. So Unless we do this sonography at the abdomen, it is difficult to find out.